Good evening, everyone. Sapna this side. I'm the head of marketing and business development at Fakeeh University Hospital. With me is Professor Dr. Amir Nisar. He's a consultant general surgeon as well as head of surgical services here in our hospital. Welcome, Dr. Amir.
Thank you.
And today's topic of discussion is Surgical Institute, which is a newly launched or curated entity at our hospital. And I have a couple of questions for you, Dr. Amir. We would like to know from the head of surgical services that what is the concept or what is the purpose behind having Surgical Institute at Fakeeh University Hospital?
Thank you. It's a very pertinent question. I think first and foremost, I must introduce the background.
Sure.
Because in Fakeeh University Hospital, Dubai, we are carrying a legacy of more than 40 years. And it's a very well established name and a very respectable name in the health industry and the private care. The other thing about the Fakeeh University Care Hospitals is that it has presented many firsts, like the first intravitreal fertilization, IVF, the first renal transplant, the first heart transplant. And those were done as long as good 30-35 years back in Saudi Arabia. So we are carrying that beacon, that baton, that torch forward. And we have all the setup, all the ethos, all the basics from Fakeeh Mother Institution. At Fakeeh University Hospital, we have the vision of making it the best hospital and the institution in Dubai and the Middle East and in the MENA region. And from that point of view, there are three ingredients to any institute, and especially to Surgical Institute. The first is the building and the facilities. And we have the top of the range building and facilities here at Fakeeh University Hospital. The second thing that a hospital needs is the equipment and all the support structure, the equipment and the staff. And we have all that. And finally, if you have a nice Ferrari, you need a nice driver and good driver to win the race as well for you. And our clinicians are among the best. And the clinicians who are working, and especially the surgeons in this hospital, they are all experienced surgeons from United Kingdom, Europe, America, and many other countries who have at least 10 to 20 years of experience in tertiary referral centers.
Okay.
So that's what makes this a surgical institute where we offer comprehensive benign and cancer care with a total dedication, commitment to the highest levels that is expected in Europe or elsewhere. And we are committed to that, and this is a service that we are offering in a surgical institute at Fakeeh University Hospital.
Okay, this is a wonderful answer I can understand from you, doctor. What do we do at FU at Surgical Institute?
I think in Surgical Institute, if I started just from the surgeries itself, though surgery comes at a later stage, but I think I would like to start with surgery. So the operations that we are offering, they are the state-of-the-art operations, mostly minimal invasive operations, whether this is general surgery, urology, gynae, orthopedic surgery, and pediatric surgery. And we are offering the latest operations where the cuts are small, the recovery is quick, and the patient's return to home and activity and back to work is very quick over here. And majority of our operations will be the routine operations. Let's say if I was talking about general surgery, we'll be doing gallbladder surgery, hernia surgery, anti-reflux surgery. But at the same time, we do minor operations as well. Like we deal with the hemorrhoids, lumps and bumps, lipomas, cysts. And even these operations are as important to us as our other operations that I mentioned. But if we went to the top of the range operations, then we offer cancer surgery, like esophageal cancer surgery, stomach cancer surgery, bowel cancer surgery, kidney cancer surgery, uterine cancer surgery, ovarian cancer, and we deal all sort of cancers, not only in adults, but also in children as well.
Okay.
And the level of expertise is such that we are not only getting patients who might have been refused surgery elsewhere in Dubai or United Arab Emirates, but in the other hospitals as well. And those patients whose operations are deemed difficult or complex, they do come over here and we do offer them comprehensive service.
Okay.
But apart from that, surgery is only just one part of the whole journey of the patient when they come to the hospital. It comes to the diagnostics, and we have state-of-the-art MRI scanner here. The CT scan is excellent. Our radiology department is very efficient. So are our laboratory services. Our nursing staff is excellent and they are fully equipped to deal with all the complex situations and look after the patients very well in a very caring and loving way. And our intensive care unit is also excellent. And I think the most important factor in any surgery is the expertise of the anesthetist and the anesthetics, because we work as a team. And I must confess that I'm very privileged to be working with some top anesthetists over here. So the whole journey for a patient is very carefully planned over here. Excellent clinicians are selected, and at the same time we have all the latest equipment that is required to offer the best possible and the safest care to our patients.
Okay, so I understand it's a comprehensive service which has been given to the patient, starting from physicians, support services, facility, technology. But doctor, when it comes to patients, what is important for patient recovery?
I think patient recovery means many things to many people.
Yeah.
And from our point of view, I may say that I've done a surgery and the patient has recovered well, he has gone back to work. He has been discharged from the hospital. And that is important and that is relevant, and that is the clinical recovery of the patient. But in Fakeeh University Hospital, we take everything into account. It's not only the patient clinical recovery from the surgery, recovery from the pain, the trauma that they had from the operation, but the whole exposure and the experience that they had. And we don't want our patients to suffer. We are living in 21st century. This is not like last millennium where pain 3 or 4 or 5 out of 10 is expected and patient has to live with that. The patient going out of the hospital holding his tummy or holding his knee going out of the hospital. We want our patients to have the best possible experience after surgery. We pay special focus to their recovery, their enhanced recovery, so that they recover quickly, they start eating early, they mobilize well, and especially that the pain is minimal.
Okay.
And we try to keep their pain in most of the cases in laparoscopic and other surgeries down to 0 to 1, so that the whole experience is very pleasant for them and they are not traumatized by coming to the hospital. And that's the reason why we have introduced some new techniques in this hospital, which we call as minimalistic techniques, and we call those as 21st century techniques as well, where the patient recovery is quick and they get out of the hospital in an early fashion. They return to work, return to mobilization, return to driving, and return to exercise is the shortest possible if they're coming to Fakeeh University Hospital.
Okay, this is interesting. Return to work, return to mobilization, return to driving, and patient is pain-free.
Absolutely.
Doctor, we have audiences, and do you have any advice or recommendations for choosing the right facility or physician for their surgeries?
I think that's a very interesting question, because there can be many facilities or many options or choices for us to have. Now, if I want to buy a big plasma screen, definitely Google search it, or I may choose to visit 1 or 2 shops as well to have a look and see the demonstration. These plasma screens, the expensive ones, may cost us 10,000-20,000 dirhams. And if I want, but I do shop around. At the same time, if I want to get a beautiful jewelry set for my wife or someone, I would like to look at a diamond and I would like to look at it, what is the best quality. We know diamonds are precious. We know the electronic gadgets are precious as well. But the human life is priceless. And when it comes to us or our family, we should leave no stone unturned to make sure that we provide them with the best possible care that we can afford.
Yeah.
And from that point of view, choosing a hospital which is comprehensively excellent and all the facilities are very good over there, and which is safe for myself and my family, that is the right hospital for me and for my family. Now, I have worked in the United Kingdom for good 33 years, but if I needed an operation, I'll not go back to UK. I'll have this here in Fakeeh University Hospital, because having worked here, seen all the action that goes on behind the scenes as well, I'm truly confident that I can recommend it safely to myself and my family. So I think choosing the right hospital with the right backup, right facilities and the right expertise, and the motivation behind the service as well, which is crucial. That is serving the patients with total dedication. And that is what is found at Fakeeh University Hospital. And I'm very proud of being a small part of this organization to be able to offer that.
Thank you, doctor. This is a great recommendation, and thank you so much for your time today. And signing off today from here. Thank you so much, everyone. Thank you.